Hello everyone, and welcome to this talk from the Warwickshire Dietetic Service. In this session, we are going to discuss how eating well can help you feel fitter and healthier. We are also going to share tips about shopping, cooking and eating for the days when you haven't got much energy. These are the topics we are going to cover today. Some of you may already have had to change what you eat due to another medical condition. For example, you may have diabetes or kidney disease. If you have, it is important to keep to your prescribed diet, but the tips we share today will give you more ideas of what to eat and drink. When you have lung disease, it's important to be a healthy, steady weight, but this can be difficult. If you are overweight, your heart and lungs have to work harder, making breathing more difficult. Extra weight can often mean that your body needs more oxygen. Being underweight can make you feel weak and tired, and you could be more likely to get an infection. If you are overweight and decide to go on a weight-reducing diet, that's fine and we'd have no concerns. But if you start losing weight without trying, it's time to have a look at what you are eating. Unplanned weight loss can occur because when you have a lung complaint, breathing can be hard work and uses additional calories. When people feel ill, they may also experience a loss of appetite and so lose weight. Unplanned weight gain can occur with steroid use or reduced activity due to decreased energy levels. Again, if the weight change is unplanned, we'd like you to look at what you are eating and drinking. Next, we are going to talk about BMI, the ratio of weight and height. We estimate if your weight is healthy by calculating your body mass index. A healthy BMI is between 18.5 and 25. That's the yellow section on the chart. It is recommended that for people with lung disease, it is ideal to be at the higher range of healthy, so you have reserves to help during an infection. If you want to know your BMI, your GP or practice nurse can help you, or go to the nhs.uk website. The aim is to keep as healthy as possible. Changing your eating habits will not cure lung problems, but it can help you be better for longer. Good nutrition helps the body fight infection. Chest infections can lead to hospitalization for people with lung disease, so it is important to reduce your risk of infection by following a healthy diet. We are going into the details on the next few slides. Healthy eating is important, but sometimes you may need to deviate from this slightly if you are having difficulties eating and drinking or keeping a healthy weight. We will discuss this later in the presentation. To prevent wasting or weakening of the muscles that you use to breathe, it's important for you to consume enough calories and protein, but other nutrients such as vitamins and minerals are also important. The Eat Well guide shows 5 different food groups. If you eat foods from each group in these proportions, you will get all the nutrition you need, with one exception which I will come to later. If you find that you cannot eat from each group in the correct proportions, you may need specialist help to make appropriate changes. Ask your doctor to refer you to a dietitian for more advice. Carbohydrates, also known as starchy foods, are the main source of energy which is needed by every cell in your body. Have some carbohydrate with every meal to maintain energy and activity levels. Whole grains are better than refined varieties as they also provide B vitamins, essential fats, protein, antioxidants, and a wide range of other nutrients. They also provide fiber. This makes them more filling, so can help you lose weight. Soluble fiber, the type that softens in water, can help reduce cholesterol levels and keep your blood glucose levels steady. Insoluble fiber is excellent for bowel health. It can relieve both constipation and diarrhea. There are other parts of the plant which may have health benefits, and they are still being researched. Fruit and vegetables contain vitamins, minerals, and antioxidants which can help protect against disease. Eat fruit and veg containing different colours, as the colours show that the fruit and veg contain different vitamins, minerals, and antioxidants. This is where the message, "Eat a rainbow," comes from. Most people know the 5 a day message, But how much is one of your 5 a day? A portion is a handful of fruit or vegetables. If you weigh that, that's 80 grams, which is just over 3 ounces. Fruit juice and dried fruit can only count as one of your 5 a day, regardless of how much you have. Resveratrol is an antioxidant found in apples with red skins. You may also find it in berries, red wine, red grapes, and peanuts. Research has found that resveratrol can help reduce inflammation in people with COPD. This group is the healthy sources of protein, which are essential for growth and repair of the body. Beans and pulses are mentioned first as they are very healthy, and we want to raise awareness of concerns over eating too much red and processed meat, both for your body and for the planet. It is recommended that we eat no more than 70 grams of red meat a day, as researchers found a link between bowel cancer and high red or processed meat consumption. Red meat can maximize the oxygen carrying capacity of the blood and help maintain energy levels. This is due to its iron content. If you don't eat red meat, you can also get iron from fortified breakfast cereals, eggs, lentils, nuts, and beans. The iron from these foods is better absorbed if you take it with a source of vitamin C. Have fruit with your breakfast cereals or a glass of squash or juice with a meal. Foods in this group can help you stay healthy in other ways. They contain zinc, which improves healing, and selenium, which can boost your immune system and improve your mood. If you are concerned about low mood, it may be an idea to see your GP about what help is available. Oily fish, such as salmon, mackerel, sardines, trout, or herring, contain omega-3s, which are important for overall health. If you eat tinned sardines, pilchards, or salmon with the bones, you will also be adding calcium. Dairy foods are a good source of calcium, which is important for healthy bones. They also contain protein. Steroids can affect the body's ability to absorb calcium, so it is important to have a good intake. Aim for 3 portions a day. 1 portion is a third of a pint of milk, a piece of cheese the size of a matchbox, or an individual pot of yogurt. Whilst there is no clear evidence that dairy causes a buildup of mucus, some people find it affects them. If you do not manage 3 portions of dairy or are avoiding it, you can also get calcium from oily fish, bread, fortified soya milk, and fortified breakfast cereal. Vitamin D is also needed for healthy bones. In the UK, it is difficult to meet recommendations through diet. If you don't get much exposure to the sun, you will need a supplement of 10 micrograms per day. Ask your GP about this, or you can buy over the counter. Some fats are essential for our body to function. However, there are different types of fat, and some are better for us than others. All fat is high in calories. Vitamin A and E are found in fat and can help fight off infections and boost immune system. Unsaturated fats are the poly and monounsaturated ones, such as sunflower and olive oils. Saturated fats increase the risk of heart disease and stroke. They are the fat in lard, butter, and cream. Has anyone ever told you to eat butter as it's better than margarine? That's because there is a fat that is worse for you than saturated fat. These are trans fats, made when oils are made into solids. In many countries, margarine manufacturers leave the trans fats in the marge, so it's not healthy. But in the UK, trans fats are removed, leaving behind the healthier, unsaturated fats. This means it's okay to eat margarine manufactured in the UK. So that's the 5 essential food groups covered, but you might have noticed that a lot of popular foods haven't been mentioned yet. These are the foods high in sugar and fat. They are not in the Wheel of the Eat Well guide, as they are not essential foods. You can get everything your body needs by eating from the 5 food groups already discussed. Sugar in particular is just empty calories, but also can damage your teeth. These foods should be considered treats that we have once or twice a week only. If, however, we are looking at trying to increase someone's weight, then we may talk about eating more of these foods. We all need to drink at least 6 to 8 cups of fluid each day. You may need more when you have lung disease to help mucus move and prevent infections. Drink any alcohol-free drink you like. Tea, coffee, squash and soup all count. If you are not sure if you are drinking enough, check the colour of your urine. When you are well hydrated, it is a light straw colour. If you use packaged food and drink, then the front of package label can tell you a lot. It may be colour-coded like this one, or just be black and white. If there is no front of pack label, then look at the nutrition table on the back of the package. The more green items, the healthier the food or drink is. The table at the bottom of this slide shows you the numbers to look for if there is no front of pack box. The numbers are per 100 grams, not per portion, so be sure to look at the right column. If you are just looking at the numbers, it can be very confusing to look for a totally healthy item. Pick on one nutrient to look for. If you are buying a ready meal, look for meals that contain at least 15 grams of protein per portion and 400 calories. You'll find the protein information on the back of the pack. People with lung disease tend to use more energy to breathe. Studies have shown that in some people, the muscles used in breathing require 10 times more calories than those of a person without lung problems. At the same time, if you lose your appetite or don't have the energy to prepare food, the situation becomes worse and you can lose weight without trying. For this reason, the next section of this talk gives you tips on shopping, cooking, and eating when you don't feel very well. People with lung conditions tell us that they often miss meals as they don't have the energy to shop or cook. Here are some tips for saving energy but still eating well. Most supermarkets deliver now. If you don't like ordering online, Milk and More is your milkman and you can order over the phone with them. It's a good idea to have some ready meals to hand for days when you are not feeling quite so well. Use the label information on the previous slide and look for ones containing 15 grams of protein per meal and around 400 calories. You may also have to add more veg. To reduce meal preparation, use frozen or tinned vegetables, tinned meat or fish, and ready-made desserts. You can even buy ready grated cheese. You can get meals delivered to your home, and you are not obliged to have them all of the time, as you can order what you want, when you want. The Warwickshire Meals on Wheels service can deliver a hot meal to your home. Takeaways and restaurants are other good options. Lots of community cafes across Warwickshire provide low-cost meals, but also someone to chat to. If you are finding eating and drinking difficult, here are some tips. Time of day. Eat meals when your energy levels are at their highest. For some people, this is in the morning, but others need to wait until 11 or mid-afternoon. Stick to nutritious snacks at other times. Try sandwiches and cake with custard rather than biscuits and crisps. Eat little and often. Maximize nutrition. Eat several small, nutrient-rich meals. Choose foods that are easy to prepare to conserve energy for eating. Take it slow. Eat slowly and chew foods thoroughly to avoid swallowing air while eating, and rest before meals. Texture. Soft foods help if chewing seems to increase fatigue while eating. Sometimes drinks such as milkshakes, smoothies, and nourishing soups are easier to eat than meals. Gas and bloating. Avoid foods and liquids that cause gas or bloating, such as fizzy drinks, beans, cabbage, and onions. A full abdomen can make breathing uncomfortable, as your stomach can feel as though it is pressing into your lungs. Being full of wind can make you feel fuller quicker and so you can eat less. If you eat a lot of salt, it can increase the fluid you retain. Position. Eat while sitting upright to ease lung pressure. Wear a cannula while eating if continuous oxygen is prescribed, as eating and digestion require more oxygen. Breathe carefully and sit with good posture while eating to avoid inhaling food or drink. Fluid. Drink liquids at the end of the meal to avoid feeling full while eating. Caffeine can interfere with some medications and cause nervousness or restlessness. Check your medication notes and limit caffeine. Side effects vary depending on the type of steroid you take and how long you are on oxygen. If you get a sore mouth, you might eat less. You may find that nourishing drinks and soft foods are easier to take. A dry mouth can happen when on oxygen or breathing through your mouth more. This can change or reduce the taste of food. Ask to be referred to a dietitian for personalised advice. Steroids can increase your appetite, causing you to put on too much weight unintentionally. If blood glucose becomes high, you will need a diet to prevent diabetes. Increased weight can make this more likely. Some people need tablets or insulin injections. Steroids can weaken the bones. Make sure you have enough calcium and vitamin D. Indigestion. This can stop you eating, so sitting upright and avoiding big meals can help. Food is one of life's pleasures. Eat well to stay well. If you have any further concerns or would like some individualised advice, ask your GP to refer you to the dietitians. Thank you for listening.